are here at Inside Wellness Center, and we will be interviewing Dr. Bari Fenster. Hi, Dr. Bari. How are you?
Doing very well. How are you, Katrina?
I'm doing well. And tell me a little bit about Inside Wellness.
Inside Out Wellness is a chiropractic and physiotherapy office in Hamilton, Bermuda. We're in the Dallas building, and it's Dr. Reed Robinson, myself, and Raina Steer, who is a physiotherapist. Dr. Reed's a chiropractor, and he's been practicing in Bermuda for 9 years, and I've joined the team about 1 year and 4 months ago. My specialty is pediatrics and pregnancy chiropractic, and it's been a pleasure working here so far. Chiropractic is based on the premise that the body is self-healing and self-regulating, essentially that we're designed to be well. And we think that the body is able to coordinate all of these little miracles through the function of the nervous system. So while we have a reputation historically for being doctors who treat back pain and other musculoskeletal ailments, the true purpose is actually a lot deeper than that. So generally what a chiropractor will do will assess a person's overall health, focusing on physical factors that could influence health, chemical nutritional factors that can influence health, and mental, emotional, spiritual factors that can influence health.
3, 2, 1, rolling.
So, Dr. Bari, share with us how, as women, we like to wear our heels, and some of them are quite high. How does this, or how can this make us offset when you talk about the pelvis?
Right. In chiropractic, the joke I make with my patients, 3 of the worst things that you can do for your lower back as a woman are to wear high heels, to be pregnant, and to shovel snow. And fortunately in Bermuda you've escaped the shoveling snow component, but the wearing high heels and the being pregnant are a little bit challenging on the lower part of the spine. If we look at a picture of the spine, I don't know if you can catch this. If we look at the curvature in the spine, the tendency of the low back is to curve in this direction. Our spines develop curves just to have strength, much like a bridge would have a curve built into it for strength as well. So the curve is a good thing. However, as baby is growing in abdomen here, the center of gravity shifts on the body, and you get this curvature pulling inward just a little bit more. The same thing happens when you're wearing heels, as it tips the body's center of gravity forward, and then the act of shoveling snow. The other thing that a lot of people don't think about is sleeping on their stomachs, and this can also kind of mimic the same sort of pattern in the low back. So we do a little bit of lifestyle coaching with our patients at Inside Out Wellness.
And so you also deal with the pediatric side as well. So how young can you bring your baby in to see you?
I have been at the birth of 2 of my patients, so from seconds old until 98 years old. I think that's my oldest patient.
And what might be some of the reasons that a mom might choose to bring a baby in?
Some parents just choose to bring children in to get a generalized wellness check. Over 65% of neural development happens in the first year, so it's one of those things I say you don't have to bring your child in, but there's this little proverb, as the twig is bent, so grows the tree. So depending on what your philosophy is on health, I mean, for me, prevention is a little bit easier to work with than cures later on. So a lot of parents opt just to bring children in for a check. Otherwise, some, symptoms that the body isn't functioning as best as possible. If you see difficulties breastfeeding, difficulties latching on one side versus the other, colic, gas, excessive wind, when they get a little bit older, ear infections or persistent skin rashes, all of these sorts of things indicate a body out of balance. So
what about reflux as well?
Reflux as well, yeah. Digestive disturbances, constipation, those are all things that we see. Essentially, when you're born, if you're drinking breast milk, you should be healthy and functioning normally, having regular bowel movements, no issues breathing. A healthy body, we're designed to be healthy. If we see fluctuations in normal function, that's when it's usually time to get a check, just to see if there's a neurological base for it. I think it would be incorrect to say that we treat specific conditions. If you have, say, this presentation, I'm going to adjust this segment of your spine. But there are certainly common complaints that come into the office that do respond really well and heal a lot faster when the body and the brain can communicate better. Autism and ADHD are a very big topic because they're multifaceted, and I don't think that there's one clear, concise answer on what the causative, what the causers of those disorders are. From a holistic standpoint, we have ways that we look at the body and say, okay, where is the stress in the body and how do we remove that? And we think that if a body has stress removed, then the body is left to function a little bit better overall. So normally, it's really case dependent, but generally there's some sort of link with nutrition we find as well, and making certain nutritional changes in addition to working with the nervous system has brought about some nice changes in children.
And with these adjustments, do they hurt?
Everybody wants to know. I guess I can't speak for everybody, but in general they don't. They're completely painless. They should be painless if they're done properly. And it's usually only if there's a bit of muscle spasm or muscle tension where you feel a bit of discomfort. But the adjustment itself, all that we're doing is restoring normal motion to the body. It's not doing anything the body wouldn't normally want to do. So bringing normal function back isn't necessarily a painful process.
And do you have a specific style, especially that you specialize in, something as like pregnancy and pediatrics? Do you have a specific style compared to other chiropractors?
Right. There's I think 76 different methods within chiropractic, so everyone is trained under the same ways. Not all 76 of those are taught at all of the schools. There's a major 10, and then beyond that there's some variations. And we all are taught the same basic ways, and everyone kind of finds their own path. I use what's called a diversified technique. It employs a lot of techniques together. I think that there are a number of bodies and body types, and it's best to have a toolbox that will incorporate techniques for all of that. And then as far as the pediatrics is concerned, I use really, really gentle technique. It doesn't require a lot of force to create a whole lot of change there. It's usually just the weight of a pinky. And that training I obtained through the International Chiropractic Pediatric Association. So there's a group of doctors around the world who are practicing the same way.
So lastly, Dr. Bari, something that might be on the mind of many parents is, do you take insurance?
Absolutely. We do take insurance, and we're fortunate in Bermuda that insurance does cover for pediatric care as well. They do sometimes require case-to-case approval, but for the most part, there's wonderful coverage here.